Welcome everyone. Welcome to the Bridge Builders of Diversity. Today we're going to talk about NICU babies.
Oh, yes, we are.
I am a mom of a child who was in the NICU. My son, he was born at 37 weeks, but he had a hole in his heart. So I've been there, done that. It's not a fun experience, but it makes you stronger.
Absolutely, absolutely.
Yeah.
So for those of you who don't know what a NICU is, it's a neonatal intensive care unit, and it is for moms who are going to deliver a child who they may know is going to have perhaps a birth defect or a lung issue, something that needs specialized care. And sometimes you can have things happen post-delivery that will precipitate a child to be brought to the NICU. That is an event perhaps that you didn't know would happen, like a cord around the neck. If the baby's had defecated in the womb, that can be an emergent thing, especially in the lungs. They can aspirate or inhale that and cause pneumonia, things like that. But the NICU has a lot of specialized equipment. It can be it's a very harrowing experience for parents, and they need a lot of support.
Yes.
A lot of education by staff. I mean, I work at a hospital that happens to have a NICU. And those nurses, I am in awe of them. They're amazing. I work in an emergency room, of course. When we have someone who's come in, a mom perhaps who is preeclamptic, and baby needs to be monitored. Preeclampsia is a high blood pressure, super high blood pressure. The mother and the baby can really it's life-threatening. It can be very life-threatening, and you lose both of them. I've seen it happen, so it's horrible. But the NICU nurses come right down to us in the ED, and they monitor both mom and baby. Usually they're whisked right up. They don't spend a long time in the ER with us. We determine what's going on, and we get them right upstairs.
Absolutely.
And you know, in this instance of hypertension in the mom, seizures can occur. Things like that. I've actually seen a mom come through seizing, and she did not survive. Baby did.
Yeah,
Mom did not survive. So, but anyway, the NICU staff, I mean, you have neonatologists, they're dietitians special for neonates who have heart disease. I mean, they take care of all these things. Pharmacy teams involved, social services right away. They should be involved so that parents are given some type of plan. You know, this is what you can expect. There should be so much education. I don't know Sherry's had a different. This was 14 years ago. I don't know.
Almost 15. My
right,
son's going to be 15 shortly.
Right.
So he was born with Down syndrome. He had a hole in his heart, a VSD, ventricle septal defect. And when I had a C-section, and I was still kind of a little out of it, and my husband at the time had gone to pick up our other son to bring him back to see his brother after I had him. So thankfully I was still a little out of it from having the C-section. So the nurse had asked me if I wanted to feed him, and I said, why don't you? Because I didn't feel like safe to be able to. Thank God I said that, because he started having trouble breathing when he had took his first bottle, because he wasn't able to coordinate his breathing with his heart. So his lips were turning blue and everything. So thankfully he was in the skilled hands of a nurse, and he was in the little area where they have the babies there. I can't think of the name of it.
The nursery.
Thank you. And
look through the window and wave.
Yeah. And they got him right on the oxygen. They got him packaged up in one of those little incubators. And his brother actually saw him, and my husband at the time. They were getting off the elevator with my parents, and there's their brother, you know, and right there, because he was getting ready to go down to the NICU. So they got to see him for a few seconds before they brought him down. But it was a pretty quick process. But at least he got a peek at his brother from delivery.
Right. And that's an example of a child being born and going right to the NICU.
Right.
Sometimes some infants can go home and develop a health problem that would require them to come back and be admitted to the NICU.
Yeah.
And there's different levels of NICU. One is regular nursery care that most hospitals that deliver babies have, just known as the well baby nursery, where they monitor them. Then there's a level 2, which is intensive care for sick and premature newborns, but they're stable. They're not in a life-threatening situation like having cardiac difficulties. And then level 3 is more comprehensive for the more seriously ill newborns and the more preterm babies, the ones that are really struggling and need perhaps surgery or have more impactful medical conditions. And then level 4 is the highest level neonatal unit, and that's 24/7 monitoring. What Kim had described, that team of social services people, pharmacy, and these angelic nurses that know how to keep these babies alive to the best of their abilities, and they have really premature babies and NICU babies face a wide range of long-term complications, some of them being cerebral palsy, which often happens from like an infection, adequate blood supply to the brain, right down to just later on learning difficulties. They can have vision problems, which was interesting. A lot of premature infants have developed retinopathy. So, that's something that hearing problems later. And then this is the one that I really didn't know anything about, was dental problems. They say premature infants are very susceptible.
More susceptible.
Whoa. Let me put my teeth back in. To dental problems such as delayed tooth eruption, tooth discoloration, and improperly aligned teeth. So that was super interesting. And then again, longitudinally, that behavior and psychological problems may happen after NICU. That's far less likely to happen. Or they might have chronic health conditions like asthma or just feeding problems down the road, but those two are less likely to be outcomes of being in the NICU.
My son had breathing issues for a long time, asthmas, RSV. Anytime he would get sick, that was always a big concern.
Yep.
Even still that he's older, I still very much watch for it because that's always been something that's induced that in him. But I had a wonderful NICU nurse. I still remember her name. Her name was Barbara. She was wonderful to my son. And having a son with Down syndrome, one thing she said to me when I left the NICU, it was December 7th, actually. I still remember the date. Here's your kid, and figure out how to feed him now. But one thing she said to me that's always stuck with me is, don't let anybody tell you he can't.
Absolutely.
Because he's not defined by Down syndrome, he's not defined by his heart. And I've always pushed him, to do appropriately, and challenged him, because that's how you progress and move along in life and get better and better at things.
Well, I just shared with you the story of the student in our school who is very preterm, like in around 20 to 23 weeks. Born weighing about a pound. I remember reading her intake from birth to 3 and thinking, oh my goodness, this little girl is going to be so impacted. And I met her at 3 years old, and she was very typical. And a tough little cookie, and still is out there making the world a better place because she's in it.
That's right.
So they're not always negative outcomes. These outcomes that they can happen, but aren't necessarily going to happen. Miraculous things are happening with the NICU right now.
Yeah, I had a friend whose daughter was born 20-something weeks. I don't remember. She's 18 now. She was born at 1 pound 1 ounce. She needed cardiac surgery. They had to put a stent in her heart, and she was a little thing, but it needed to be done or she would die. And there was some world-renowned surgeon from Europe that was here who actually did the surgery because she was too small even for the doctors locally to do. And he happened to be here on a conference. And a classmate, the connections, right? She went to school with a girl whose father was a cardiologist or a cardiac surgeon in Boston who got this guy.
That's amazing.
Yeah. So good thing about New England, we all kind of know each
Yeah,
other.
Small enough for it.
So they did the surgery. It damaged the growth plate in her legs, and in one of her legs where they had to put the stent in, and she ended up having to be an amputee. But she's doing wonderfully. She's driving and everything. She's gone through school, and doing marvelous. You know,
Tough
she's maybe a
cookies,
little bit smaller for her age. But she's doing marvelous.
But
and,
good things come in
That's right.
small
Right.
packages.
Yep.
That's right.
and we will do a video on amputees. I'd love to do that, even for our military
Absolutely.
brother and sisters as well. You see more and more of that. You know, you saw
Yes.
that back in the 70s after Vietnam, and
Now we're seeing it again.
we're
and
seeing it
actually
again.
at a higher survival rate
yes,
Yes.
because field medicine has improved. So
yes, yeah. So we will bring you a video on that as well.
Yeah.
if there's anything else, if there's a question that you have about NICU, we'd love to look it up for you and find out more.
March of Dimes actually has I wanted to just mention this, March of Dimes has a NICU family support program. It's across the nation and about 120 hospitals. And they give support to
Didn't they have an app or something?
They do.
You can
There's
look that
NICU
up.
Babies.
Yeah.
But go to the March of Dimes NICU Family Support Program page, and it just gives, that whole app has like your baby's weight. You can monitor things through that app. It's a great thing.
Super
I wish
helpful.
more hospitals had it around the country.
Yeah.
But anyway, it's a good
Don't
support.
forget to subscribe to our channel if you like our content. Hit that thumbs button, smash that button, subscribe. I'm Sherry. I'm a mother of a child with Down syndrome. This is
Ken Lima, ER nurse.
and
And Roberta, I'm a special education teacher.
so
And we appreciate you, and
Absolutely.
yeah, let us know if there's anything else that you want to know about, because that's what we're here for. We're building bridges of understanding for the disabled community and the rest of the world.
yeah, so people can understand and not be frightened by the disabilities and
We're just ordinary people too, sharing stories. So
absolutely.
try not to get too technical about definitions and things.
Yeah, right.
Just give it to you straight.
All
And
right.
then forget words, so
You know.
sorry about that.
All right. Appreciate
Thanks,
you
guys.
all.
Bye.